In the United States, one child out of 1,000 will be born deaf. In Africa, it's much higher. It's up to 7 in 1,000 in Nigeria, 6 in 1,000 here in South Africa. And we estimate that in high-income countries like in the US, for example, 50% of children that are born deaf are because of a genetic cause. In Africa, our estimation is around 30%, so there is a lot of environmental cause, specifically meningitis, that lead to deafness. But our focus is on genetic cause. Our study have shown that 90% of children that are born deaf are born from hearing parents.
During your research, what did you find in terms of the probable cause? I know you talked about environment. If you want to focus on the African context, what do we see more often?
It depends where you are in Africa. If you are in the middle of Africa, like in Cameroon, Mali, where we are performing some of the study, or in Senegal, meningitis is the most common cause. But we are still very much interested in genetic cause, that is only the 30%. But even with the data that we have now, we know genetic cause is a good component within the continent, and it can vary from places to places. In Cameroon, for example, it's 30%. Our estimation that in Mali is much higher, and the reason is because of the consanguinity, because people can marry amongst cousins. That increase a little bit the proportion of genetic cause.
So what did your research, or what does it entail?
We use genetic to investigate, specifically a technique called whole exome sequencing, where we sequence all the 20,000 genes that we have and analyze them. The first thing that we confirmed was that gene that is very common in Europe, connecting 26 genes, definitely do not explain hearing impairment in population from Cameroon, in population from Mali, in population from South Africa, in population from Senegal, in population from Nigeria that we have recruited. There is one exception for that genes, is in Ghana. In Ghana, we found that GGB2 genes, connecting 26 genes, explain up to 40% of children that are born deaf. And we found a mutation that is only found in population from Ghana. The second finding that we found is that there is one gene that is called myosin 15A gene that explains more families that have hearing impairment in at least 3 of the family of African countries that we have investigated: Cameroon, also in Ghana after GGB2, and in Mali. The other thing is that we know that there is a potential for novel gene discovery in Africa. For example, in Ghana, we found 7 novel genes of hearing impairment. So that we believe that even with this preliminary data, there will be a strong contribution of Africa toward novel gene of hearing impairment globally.
What can you say in terms of the sort of impact that such research can have in prevention of deafness on the continent? Is it even possible to talk about prevention?
The real life of patient is more than genetics, it's the impact on family. So when we had the first meeting, we realized that we did not plan to have someone that can sign. So the first barrier that we found was language. The second barrier that we found was a high level of stigma. Most of these families are perceived, or individuals are perceived, like having intellectual disability, which is not the case, because in most of the cases, they have just hearing impairment or nothing else. The third level of difficulty we found was that the school for the deaf was not accessible to most family and most children. The children need to be screened for hearing impairment at birth. So that's really the most efficient thing that needs to be done. Is that available? No. In the public sector, there is no newborn screening for hearing impairment. Depending on the level of hearing impairment, external hearing aid can be provided. It was not accessible. In South Africa, generally, yes, but in the other African country, no. But there have been some progress. For example, we found some group in South Africa specifically that can use smartphone to test for hearing impairment even early in childhood.
Anything you'd like to add before we wrap?
Remember that there are many epidemics out there, and hearing impairment is one of them. It's a silent epidemic because no one talks about it. There is little intervention of it. And there are many families, many patients, many individuals that are in the corridor of desperation because the public and the public officers have not yet provide enough policy and action to alleviate the burden of hearing impairment in many families, particularly in Africa.
Professor Ambroise Wonkam, thank you so much for your time.
Thank you very much for your invitation and to give an opportunity to speak a little bit of our work to the global audience.